drug is likely to find approval based upon a survival advantage, which is the gold standard. They had a previous randomized phase 2 trial, which was replicated in the phase 3. So they really have two randomized trials, which usually satisfies the criteria that the FDA needs. The survival advantage with the randomization was to best supportive care or radium. It was a 1-to-2 or 2-to-1 randomization. And the survival advantage was quite obvious. It was about 4 months, which is very similar to either enzalutamide or to abiraterone, very similar to Sipuleucel-T. All of the drugs that have gotten approval in prostate cancer have had about a 4-month improvement in overall survival. Not only that, but there was a significant reduction in pain and a significant reduction in side effects. The side effects of the drug were actually less than the side effects of the placebo group, which was it was similar to enzalutamide in that respect. We also showed that there was a reduction in time to skeletal related events and a reduction in overall skeletal related events with only a very modest single-digit bone marrow suppression effect. In the radium study, about 57% of patients had had prior dose Taxol, but that leaves some 43% with no prior dose Taxol. So I'm using the drug quite extensively. I'm the largest user of the drug currently in the United States in the what's known as the Expanded Access Program. And we're only treating 2 patients a month due to drug supply issues and widening of the distribution channels. But of those patients, I would say about half are those who have refused chemotherapy. They've just said, no, I'm never, or at least not never, but in my experience, I'm never going to take chemotherapy. You know, they always reserve the right to change their mind. But in general, about half of them say, I won't take chemotherapy. And for them, it's a wonderful option because it suppresses the cancer, controls the pain, extends their life. Those patients who had never had chemotherapy in the radium study actually lived longer, of course, expected, than those who had had previous chemotherapy. But the difference was seen in both groups, those who had chemotherapy and those who had not had chemotherapy. And the survival benefit was roughly equivalent in both groups.